Good evening and welcome to our informative and interactive live session designed specifically for new and expecting parents to understand how to care for your newborn's delicate skin in the first 30 days. From the time a baby is born, their skin goes through a period of rapid adaptation. In just a matter of days, your little one moves from the protected environment of the womb to the outside world, facing new temperatures, clothes, and products for the very first time. This is why parents commonly notice peeling, dryness, redness, or tiny bumps on their baby's skin in the first month. Many of these changes are normal, but some may need extra attention or a doctor's opinion. Simple everyday habits, such as frequent bathing, harsh or strongly scented products, rubbing the skin while drying, or using products not suited to newborn skin and its natural pH, can disturb the skin barrier. A healthy newborn skin barrier needs gentle cleansing, minimal but correct product use, and protection that keeps the natural pH around 5.5. In this session, we will focus on practical newborn skincare routines that help you keep your baby's skin soft, comfortable, and protected in the first 30 days. You will understand what is normal, what may be a warning sign, when to seek medical advice, and how to build a simple, gentle routine using products suitable for newborns. For this workshop, we are privileged to have Dr. K. Pawan Kumar with us. K. Pawan Kumar is an MBBS DCH DNB and he serves as Professor of Pediatrics and Consultant Pediatrician at MNR College, Omega Clinics, Ankara, and Lotus Hospital in Hyderabad. With over 22 years of experience, he holds fellowships in allergy, asthma, and clinical immunology, plus postgraduate diplomas in pediatric nutrition from Boston and developmental neurology. As National Scientific Convener for Pedicon 2025 and IAP Central Executive Board member, he has trained over 2,000 professionals via 80 plus courses in NRP, PALS, and BLS. Awarded Bharat Gaurav Puraskar in 2023, his expertise covers newborn care, vaccination, asthma, and infectious diseases, with key publications and past role as IAP Telangana Secretary General. Dr. K. Pavan Kumar, thank you for joining us. We are very privileged to have you here. We would love for you to share your thoughts on today's topic.
Yeah, thank you so much, Caroline. That's a nice introduction. Dear parents, welcome today. We all know your newborn skin is very precious. Your baby skin is remarkably delicate and it requires gentle, informed care during these crucial first weeks, right? So I'm here to guide you through a thorough understanding and protecting your newborn skin barrier while it's developing and it is adapting to the world outside the womb of the mother. So I'm going to help you to build confidence in caring for your little one's sensitive skin. Are you all ready? Yes. Over to Carolyn.
Thank you, Dr. Kumar. Before we go any further, a quick reminder to all the parents joining us today that Dr. Kumar will be answering your questions live during this session to help you make informed decision about your newborn skincare routine. Let's begin with the first set of questions, Dr. Kumar. Why is newborn skin considered more delicate and sensitive compared to older infants and adults?
Yeah, it is fundamentally a lot more difference compared. It's not just like a child skin also. It is a very sensitive and very delicate. The outermost layer of the skin, what we call labely as a stratum corneum, is 30% thinner in these children compared to adults. So this means the protective barrier hasn't fully matured yet, making it more permeable to water loss and also for the environmental irritants. Additionally, the connections between the skin cells are looser and the natural moisturizing factors that keep skin hydrated, they are still developing in these newborns. The skin's pH is also higher at birth and needs time to acidify to its protective level. We all know there is a something called acid mantle which protects the baby skin. That is not yet developed in these babies. So it is very important. So I request parents to think of it as a delicate ecosystem that's still finding its balance during these first precious weeks. So the key differences, if you see, Caroline, this is 30% thinner outer protective layer, and they have the high chance of water loss, and the developing pH balance needs to be addressed. And there is a this makes the child's skin immature immune function also is another contributing factor, which makes the newborn's baby's skin delicate.
You mentioned pH balance, Dr. Kumar. Can you tell us how a pH of 5.5 supports a newborn skin barrier in the first month of life?
Yeah, this is very important to critical to understand the parents. Your baby's skin pH plays a crucial role in maintaining the healthy skin barrier. We all know at birth the newborn skin pH is around 6.5 to 7. That is like slightly alkaline, and which is mostly neutral sometimes. So within the first month itself, the skin should naturally acidify to approximately pH of 5.5. Please remember this pH 5.5. What it creates as an acid mantle. This slightly acidic environment is very essential because it inhibits the growth of harmful bacteria while supporting beneficial microorganisms which are there on the newborn skin. It also helps enzymes that build and repair the skin barrier function optimally. So, when pH is disrupted by harsh soaps or excessive washing, which most parents do, the skin becomes vulnerable to irritation, dryness, and also for the infection. So that's why this balance of pH balance is very crucial. The parents needs to protect it as an acid mantle.
You mentioned harsh soaps and washing. Are there any more everyday habits that can unknowingly disturb a newborn skin barrier?
Yeah. So even with the best intentions, most parents what they do is these common practices which can we'll see that which disturb the newborn's delicate skin barrier. So being aware of these habits will definitely help them for informed choice. So overbathing, usually this is a habit that like we bath, the newborn babies doesn't require so much frequent bathings. So overbathing is one, harsh scrubbing, using fragranced products and talcum powder. Most parents they love to use talcum powder, and most of them they don't even know they should use separate because the skin mantle is totally different. They use adult products also for the baby. They use their shampoos, their soaps, their lotions for the babies, which maintain inappropriate pH levels, and they are potentially harmful ingredients, the adult products. So we should never use them. And overbathing, we recommend 2 to 3 times a week. Please remember this. Especially in the winter, the babies don't need daily bathing because they are not sweating like us. They don't need daily bathing. So what is recommended by guidelines is 2 to 3 times per week. So if it is more than that, what happens is it can strips the natural oils and disrupts the pH balance which the baby is developing. So daily baths are definitely not necessary and can cause dryness. This every parent should remember. Second thing is harsh scrubbing. Vigorous rubbing with washcloths, sponges, they damage the thin skin layer which the baby is having. So gentle hands and soft clothes are all you need instead of harsh scrubbing. And please remember this fragrance product. Any product which is giving you fragrance, that those are artificial fragrance. They are more common. They are common allergens that can trigger this irritation and sensitization into vulnerable newborn skin. So this is very important. Anywhere you see fragrance in the products, just avoid that. And the talcum powder, nowadays because of repeated education we are discouraging parents to use talcum powder, but otherwise every mother is tempted to use the talcum powder. If it is inhaled, it is very difficult to get absorbed into the body. Child will get frequent cold and coughs. So it can be inhaled, the clumps in the skin folds creating moisture and friction. So both are problematic for the delicate skin. So talcum powder should never be used. And I already told, never use adult products to the newborn babies.
Right. So infrequent bathing, you said, avoid fragrances, right, and obviously no harsh scrubbing while you're bathing the baby. But if you were to say define a simple, safe bath routine for a new,
Yes.
what would that be, Dr. Kumar?
Yeah. Parents, please remember there is a lot of stress on you that you should use lot of products. So no, definitely here the less is more here in the newborn care routine. Less is more here. Okay. The frequency of duration already I've showed you. The bathe your newborn 2 to 3 times per week for no more than 5 to 10 minutes. Please remember the duration of the bath also. It should not be more than 5 to 10 minutes. So between the baths, like other days, you can use warm water with a soft cloth for spot cleaning of the nappy area, neck folds, and any areas where the milk residue sticks. And please remember the water temperature which you are using should be around lukewarm, 37 to 38 degrees. Always test with your elbow before putting the baby inside that. And it should feel comfortably warm, never hot. Hot water strips natural oils more aggressively. This you have to remember. And the gentle technique, support the baby's head and neck at all times. Use your hand, a very soft cloth to gently cleanse the baby. Pad dry with soft towel rather than rubbing the baby. Please remember this also. Pad dry the baby. Paying special attention to the skin folds. So this is some tips during the routine bath.
Right. Coming. I'm going to stay on the bath routine for just one more question, Dr. Kumar. Is there? I mean, what should parents keep in mind while choosing a cleanser or a body wash for their baby?
Yeah, that's a very right question, Caroline. Choosing the right cleanser is always one of the most important skincare decisions the parents will make. So here there are certain points. I say the 5 points I can tell you. The pH balance formula. We discussed the pH, why it is important, how it is important to babe. So this supports the natural acidification process of the newborn skin. That's why we choose the formulas which have a pH balanced formulas there. And always choose a product with minimal ingredients. The shorter ingredient list generally means fewer potential irritants. That we need to remember. And always choose two cleansers with a recognizable, simple formulation. So all the chemical names and all numbers, please be away from that. So less is more here. And also tear-free. Choose products which are tear-free and gentle. Products marked tear-free, they are formulated to be extra mild. So this is what we should remember. Though they should always be kept away from the eyes when possible, but tear-free, gentle thing what you have to see. And the fourth point is dermatologically tested. Please remember, use the products which are tested on a sensitive skin and ideally recommended by pediatricians or dermatologists. And fifth one, the non-negotiable one, is a fragrance-free. Even the natural fragrances can cause irritation in newborn skin. Choose completely fragrance-free options, Caroline.
Thank you, Dr. Kumar. That's really helpful. I'm going to just take a parent question over here. This is from Sia, and Sia asks how to find a good quality moisturizer and what ingredients should I look for.
Yeah, I already told you. These are the 5 points which I told you. But what ingredients? Definitely, I told you glycerin, the ceramides. Glycerin is a humectant that attracts moisture to the skin. Look for that product. And ceramides, always choose products rich in ceramides. These lipids, they support the barrier function. Always use mild surfactants like cocoa model propyl butane. It's very difficult to pronounce that. But that is mild surfactants are useful. Colloidal oatmeal. So this is one of the things which will be soothing and anti-inflammatory for the baby skin. Sunflower seed oil and Pantethol Pro Vitamin B5. So which is also helpful for moisturizing and healing. So barrier supportive, these ingredients should be there in your products.
Right. And speaking about ingredients, what do you think, Dr. Kumar, is considered gentle? And I mean, you've obviously mentioned a few, but
Yeah, these
are there
things.
specific ingredients that they should completely avoid? Parents should just completely steer
Yeah,
clear.
that is
Those
also very, very important. Yes,
yeah.
very true. That's a nice question, Caroline. So, what ingredient they should avoid is I told you the first one, the fragrance. So, non-negotiable should avoid that. Artificial, both artificial and natural fragrances can irritate. Essential oils, because these essential oils they are too potent for the newborn skin, so it should be avoided. There is a component called sodium lauryl sulfate, which will be acts as a harsh detergent that should be kept off. Parabens and phthalates. Nowadays, we are seeing the products coming as paraben free and phthalate free. What are these parabens and phthalates? We should every parent must know because these preservatives they are linked to hormone disruption. They are called endocrine disruptor chemicals. So we should ensure that these products should be there. Parabens, methyl paraben, ethyl paraben will be there. That should be not be there in the ingredient list. And phthalates are these are often hidden in the fragrance. So that's why we should be very careful. The fragrance word is a chemical. Okay. Alcohol extremely drying the child, and formaldehyde releasers also, they are the potential irritants and allergens, so which should be avoided.
Uh, Dr. Kumar, many parents tend to see peeling skin or white patches in the first few weeks of the baby being born. When is this normal adaptation and when should it be a concern?
Yeah, this is very important question you posed. Seeing your newborn skin, most of the times, it peels, and developing white patches can be alarming for the parents. But in most cases, I'm sure it is completely normal part of adaptation. Please remember that word adaptation, because from the womb, when the baby is coming out, so it will have that. So most parents, what they don't know is the white cheesy material which is there on the baby's born. If you just seen the baby who is just not cleansed or washed by the ayahs, so you will see that there is a white creamy coating on the skin. Most patients think that it is dirty and they want to get rid of. But please remember that white creamy coating on the skin, which is there right from the womb when baby comes out. Especially we can see that in a premature babies, we see this very often. It is a protective vernix actually. So it absorbs naturally within 2 to 3 days, and it provides natural moisturization and antimicrobial protection. These two properties makes it very unique. But most parents think that it is dirty thing. The caretaker didn't clean it properly, so that's how they. But if the doctor tells that this is very important, this is a natural moisturizer which has antimicrobial protection, which will help the baby to prevent infections in that delicate period of first 2 3 days. So I think parents will go there. And first 3 to 4 5 7 days, usually there is expected peeling begins. So mild peeling starts, especially on the hands, feet, and ankles. This is normal shedding of the outer layer that was adapted to the amniotic fluid inside the womb of the mother. So then usually this peeling usually, ma'am, it will peaks during the 7 to 21 days. So no treatment is needed, but gentle care is sufficient. So also you asked what red flags when we should be concerned, right? So we need to consult pediatrician if the peeling is accompanied by a raw red areas oozing. There's something oozing out of the lesions. Is there is a bleeding and the foul smell from that, and the fever is associated, definitely you should be very careful. If the patches appear thicky, yellow, crusty, like that. So if they are deviant from the normal peeling, definitely you need to consult your pediatrician.
Okay. Dr. Kumar, we have another question from one of our viewers. This is from Radha, and Radha asks, my baby's face looks dry, but the body feels fine. Should I moisturize only the face?
Yes, that's very important question. Moisturize the baby skin is fine. Definitely, you take care of the skin, only the face of the baby. There are nowadays we are getting the facial creams, specially designed for the delicate part of the skin. The facial skin is compared to body is very delicate, and very we need to be more concerned with that. So definitely that's a developing one. So we need to protect with a moisturizer daily. Yes.
All right. Another parent question I'm going to take before we move on. This is from Kirtana, and Kirtana asks, how to know my baby's skin pH? Is there a way to find out?
Yeah, the pH meter, those things are there to find out the pH of the soap, what we are using, pH of the products. There are, there are pH meters are there. But to see the baby's skin, it's very difficult to measure it. But this is what the science says. The scientists, what they say is that the baby's pH is usually 5.5. So that is the acid mantle which protects the baby's skin. So when you use automatically, this is a nature's principle that, initially it will be 6.5 to 7, and slowly over a period of a week or so, it will convert it into 5.5. So the skin pH is very essential for the newborn skin to protect itself, and that natural moisturizing effect. So to function it, this is it. But there is, I'm not sure that you can check the baby skin, but you can see the moisturizer content. Nowadays, we are seeing the instruments which we are using in office practice, in our clinics also. We are just putting the moisture content. The machine will be like a thermometer only. It will be, we just put on the baby skin, it will give you the moisture content of the thing. But pH, I don't know. Actually, there is no instrument which will check the baby's pH. It's not required also, because it's a natural way of protecting the baby. But the products, yes, the soaps what you are using, the creams what you are using, you can check with the litmus paper. It will give you that blue color.
Right. We all know that the first 30 days of a baby's life, of course, really important. Um, are there specific areas, Dr. Kumar, like the folds, skin folds, the neck, the diaper area, that need extra care in the
Yeah.
first 30 days? Are there any specific areas, the cheeks, for example?
Yeah, you rightly mentioned all these areas. What you shared just now, they require special attention because of moisture, the friction, the vulnerability to irritation. These areas are very sensitive. As you ask, the face and cheeks, the frequent milk contact can irritate the delicate facial skin. So gently, we need to wipe gently after the feeds with the plain water. Use always plain water. Okay. So pat dry carefully. Avoid products on the face unless medically necessary, and protect from excessive drool with a soft burp cloth. This saliva drooling from the baby's mouth, that can irritate the baby skin itself. So that thing also you need to take care. And the neck folds, especially the neck folds, the milk and the drool accumulates here, and it can gently be wiped off of you during each nappy change. Don't wait till you find out that. After during every nappy change, come to these areas: neck folds, nappy area, skin folds, and face and cheek should be taken care. So always use plain water with a soft cloth. Pat completely dry, as trapped moisture causes irritation again. Apply a thin barrier cream if there is a redness, if you see in the neck folds. And the skin folds, especially armpits, groin, and the thigh creases, they also trap moisture and heat. So gently separate and clean these areas during the bath time. Ensure they are thoroughly dried. This is what every parent should remember before dressing, and check daily for redness or any smell bad odor there. Okay. And the nappy area, here the tendency is the parents won't change that frequently. You need to change nappies frequently every 2 to 3 hours and immediately after bowel movements. So it's very difficult. If you put a cloth, the child will cry and it will give a signal. But if the diaper is kept, it's very difficult. The child won't give you a hint also. So we need to keep checking that. Use warm water and gentle wipes. This is the take-home message. Water is very safe. You can no need of any cleansers there. Allow air dry time daily and apply barrier cream with the zinc oxide. This is a one called zinc oxide, acts as a physical barrier. So you need to ensure that every product what you are using in the nappy area should have it acts as a physical protective layer, and not to treating the existing rashes. Okay. So what is most important take home message is keep that nappy area free. So most of the parents 24 hours they will cover the area with nappy. So nappy free time is also very important. Parents should take care.
Zinc oxide is something that's also used in sunscreens, right? Is that the same ingredient?
Yeah, zinc oxide, why they use it, acts as a physical barrier. It protects from irritants, the chemicals from the urine and stools. So that will, it acts as a physical barrier. If you apply the zinc oxide on your skin and put water like the droplets, it won't even stay there. It will just, drop off. So it acts as a physical barrier. It's a very good one.
Right. So you said water. That's more than enough, of course. And then you said zinc oxide. And I'm sure this question.
Diaper areas, people who are putting diapers, especially, they need this diaper cream. And if they find some rashes also, that will help.
Right. And is that all? Is it water, zinc oxide, a diaper rash cream? Do you think a baby should have a multi-step skincare routine like most adults do today? Or
Yeah.
is less better in the first 30 days?
Less is always better, because the baby skin has its own natural protective mechanism that works best when not overwhelmed with the products. This is what every parent has to really understand. So less is genuinely more when it comes to newborn skincare. So that is what we need to ensure there. And a complete first month routine: bath 2 to 3 times a week, pH balanced cleansers if you can try, and the barrier cream for nappy area. That's it. Nothing more is needed usually.
All right. I'm going to quickly take another parent question over here. This is from Meher. And Meher asks, I see small white or red bumps on my newborn's face. Are these normal or a sign of allergy?
Yeah, so these white patches, white bumps on the nose, this is very common questions parent asks us in the routine practice. So these are called milia. Remember this word MILIA. So these are blocked pores that will open and clear naturally within weeks. Don't try to squeeze them or pick them up. Okay, pick at them. So this is a normal tendency. The parents try to remove that. So please don't do that. And the red blotches with small white or yellow bumps in the center. So these appear usually after 2 to 5 days. This is called erythema toxicum. There is nothing toxic about it, but it is named like that. So it looks alarming, but it's completely harmless and resolves on its own within 2 to 2 weeks. That's all. No treatment is needed for these red dots or red bumps there, what she has told. And there is something called baby acne. So this baby acne also look like that, white pimples or small red pimples on the face appearing around 2 to 4 weeks. Please remember this period. So this is mainly because of the maternal hormones like estrogen and progesterone, and it resolves without treatment by 3 months. You need to wait for 3 months. Okay. So keep skin clean and dry. That is what the parents has to do when they see these bumps.
All right. We also have a question from Vanya. Vanya asks, my baby's skin keeps changing color from pink to pale to slightly yellow. When should I worry?
Yeah, this color changing is one parents will definitely ask us. So please remember, the ear pinna color is what the original color of the baby. After some time, it will come to that. Okay. So initially, it comes from the sterile environment, that amniotic fluid. It looks very pink. Baby looks very pink and white. So slowly that color fades, and baby will settle over the some few weeks later. It will set it to the color of the pinna, the ear pinna. That is what they usually come to that. So nothing to worry. That is a normal transition of the skin, and most of the skin color is genetically predetermined. So nothing much can be done there. So not to worry at all.
I'm just going to take one more parent question before we move on. This is from Babita, and this is with regard to what we spoke about earlier, zinc oxide. Babita's question is, where can she find zinc oxide?
No, it is a normal ingredient which is there, as you rightly said, in the sunscreens also they are putting it now. And any nappy products, nappy area products, if you see, it has a zinc oxide in it. This is a natural physical barrier. So, we will use it as most of the products, they have that zinc oxide. Just you need to see the ingredients list, you will find zinc oxide in that.
Right. Dr. Kumar, are there any specific, newborn skincare secrets that every parent should remember from day one? I know we spoke about keeping it minimal, but if there were these three commandments that all parents should live by, what would that be specifically?
The secrets are secrets. As I told you, less is more always. Your baby skin doesn't need fixing. It doesn't need enhancing. It does not need multiple products. The single most important thing you can do is to protect its natural development by doing less, not more. Simple, gentle care trumps elaborate routines every time. Please remember this. So always simple, gentle care. Stick to that. The first 72 hours usually sets the tone. This is a secret, but most doctors also won't tell you. But how you care for the skin in the first 3 days, it matters enormously. So that white thing I told you, the leave vernix to absorb naturally. Delay the first bath for 24 hours if possible. Avoid unnecessary products. So this gives the skin barrier its best start. And the third secret is learn your baby's normal. I request every parent daily observe, give some time. Every baby's skin is unique. Spend time during quiet moments examining your baby's skin, its color, its texture, and the patterns. When you know what's normal for your baby, you will quickly spot what's not. That enables prompt action when truly needed. So these are the three secrets I can tell. Less is more always. The first 72 hours sets the tone, and learn your baby's normal.
Right. Going to jump to some parent questions again, Dr. Kumar. Two very similar ones. The first one is from Zoya. And Zoya asks, is oil better than lotion for newborn skin? And then we have Roshni, who also asks, can I use home remedies like coconut oil or ghee on newborn skin?
Yeah, this is a very important question, and we also encourage parents to use this. Oil massage is a must for every newborn baby, not just for skincare, but it enhances the neurodevelopment of the baby. So when you massage, the babies gain 47% more weight. A daily massage, if you do, compared to those mothers, they don't know daily massage for the baby, oil massage. So these oil massage babies, they gain more, not only in terms of weight, but also in terms of the brain development also, because the skin has a many neurons. So when you massage that, all the brain will be stimulated inside. The neuronal connections will become more stronger. So that is where it scores high. So daily massage is always best. The best oil is virgin coconut oil. So remember, virgin coconut oil, not the hair oil, the one which used for hair, which makes the skin tan also. So don't use that regular hair oil one. But there is a virgin coconut oil which takes from the delicate, tender coconuts. So that oil is very good for the baby skin because it has a many anti-inflammatory, anti-infective, moisturizing properties. It has scored very high over the other components.
Right, but if you were to pick, I'm going back to the parent question again. If you were to pick oil versus lotion, I mean, if you were to pick between the two, which one would it be? Would it still be oil?
For bath, it's oil massage. During bath, mild cleanser are better to avoid soaps which have a, and if you are using a soap, so use soap with pH of 5.5. After bath, immediately after bath, you can use lotion. That like a
Right.
moisturizing lotion you can use. Yes.
Right. And you also mentioned virgin coconut oil,
Yeah.
but a lot of households in India, and this is also a parent question, this is from Ananya. Her mother in law gives her newborn a massage with mustard oil. And of course, this is very commonly seen across India. So, is mustard oil, would you recommend mustard oil, and is it safe for
Yeah.
baby?
Yeah, definitely. I request people who are using mustard oil. This is very tempted because age-old practice. At that time, we don't used to get these many oils. But mustard oil is like it's like a castor oil is like a irritant. It should not be used on any part of the skin. For usually we see that grandparents they put this oil into the nose, into the ears, everywhere they put this oil into that. So they will use this mustard. Castor oil is a irritant. Please remember this. Castor oil is a irritant. Better not to use that. If the baby has constipation, they will put into the mouth also, and that will cause diarrhea. So it has an irritant properties, but better it's not to use. No doctor recommends that except the age-old grannies who are they are not adamant. They are very adamant to change. So those people only they tell that. But if they have a discussion with doctor, no doctor encourages mustard oil for sure.
And
There are
since
other
we,
oils. There are other oils. Virgin coconut oil is the first. After that, badam oil, then olive oil, then till oil, like that sesame seed oil also. So these are like you can go down like that.
okay, all right, that's pretty helpful. Also, since we've spoken about irritants, we have a question from Ashwarya who asks, are wet wipes safe for newborns or should I use cotton and water?
So always please remember the natural because our body is designed, our skin is also designed by God naturally to have its own protective layers. So by using wipes, sometimes they are very easy to use and very easy to carry and all. But most of the times, wherever possible, try to use. If you are at home, don't use wipes. At least you are at home. When you are outside, when you have to take the child outside, at that time, yeah, definitely it's very difficult to find all these things. So use wipes at that situations only, but better to use plain water, which has a pH of 7, normal neutral pH, and simple soft cotton.
All right. I have another question from Kavya. I think we'll have to take a follow up on this question because I don't quite understand. Can saliva or milk cause skin problems on the skin?
Yeah, this is what I told you. The drool, what I call the drool, is the saliva from the baby's mouth. Once it comes out of that, it can create rashes. I think some babies will have this white rash around the mouth, sometimes red rash around the mouth. Those is because of the saliva drooling out of the babies. Sometimes the milk, if you lift the neck, you will see that there will be rashes here also. That is because of the drooling of the saliva and the milk coming there as a residue. It stays there and it can cause irritation, and that can cause skin problem in the skin. So immediately after every breastfeeding, just clean it with a white soft cloth with a clean water. That's all. That's more than enough.
Right. And let's say parents already have a history of allergy or there's a history of allergy in the family. Uh, do you think there are specific routines that parents should follow if there's a history of allergy in the family?
Yeah, definitely. If your baby has a visibly sensitive skin, or if there is a family history of eczema, allergies, asthma, what we call atopic march, this is the first bear. The future allergies, asthmas, and all, they start right in the newborn skin only. If you are able to identify that allergy in the baby skin right now, you can stop the atopic march. You can really prevent. Pediatrician can really prevent the atopic march, and it will prevent further damage or future the child developing asthma can also be prevented here. So there are definitely, yes, you need to take extra proactive approach towards this during the first 1,000 days, first 30 days. Start moisturizing early, limit bath time further. You can reduce the bath time to two baths per week. Okay. And the cube duration just for 5 minutes. Initially, I told 5 to 10 minutes, but here you just restrict it to 5 minutes. Use lukewarm water and apply moisturizer within 3 minutes of patting dry to lock in the hydration. This is a one important tip for the parents. So when to apply moisturizer? After immediately bathing, pat dry the baby, and within 3 minutes of patting dry, you need to apply the moisturizer. So that is to lock in hydration. Please remember this point. And you need to start this moisturizing very early for these babies. Use fragrance-free, ceramide-rich emollient after baths and once daily. Please remember, once daily you can use it. And choose products carefully for these people because extra sensitive skin, you need to choose product like for sensitive skin. There are products available now sensitive for sensitive skin. So avoid all fragrances, essential oils, botanical extracts that might trigger the reaction, and monitor for early signs. These parents should be extra careful, and they should watch for persistently dry patches, especially on the cheeks, outer arms, and legs, where this atopic dermatitis can develop. If the early intervention can done with appropriate moisturizing, we can really help prevent full eczema development later. So that is why the parents has to be very careful, and these parents should don't wait problem for the to worsen. They should schedule an early visit to the doctor as early as proactively. They should go for the doctor's visit.
All right. Dr. Kumar, thank you so much. I'm going to take one more parent question before we wrap up. This is from Tara, and she wants to know about her baby's crusty scalp. She's asking, is a baby's crusty scalp related to dry skin?
Yeah. So this is very thing, the oily thing which there on the crusty scalp. Those are like this is called sebaceous dermatitis. Seborrheic dermatitis of the scalp is a very itchy condition. The child will be crying, scratching his scalp. So that is mostly because of the dryness and the some glands they excessively produce this sebum. So that's called seborrheic dermatitis. We need to gently clean it, with a white tooth comb. You need to remove the crust and gently pat clean it, and you can apply some nice hair oils that will itself will take care. So it is a natural thing which will go within 2 to 3 months. You need to just be patient with that. So seborrheic, the crusty scalp is very itchy, very troublesome for the parents and also for the baby. So because it keeps coming the moment you remove it.
Yeah. Thank you so much, Dr. Kumar. That was really helpful. Thank you for sharing such clear and practical guidance with all of us today. The first 30 days with a newborn can feel very overwhelming, and but of course, with the right information and a gentle, consistent routine, like you said, parents can protect their babies and keep them comfortable. To all the parents who joined us today, thank you for your time and engaging so actively in this session. We hope today's workshop has helped you understand what is normal for newborn skin, how to support the skin barrier from day one, and when to reach out to your doctor. If at any point your baby's skin looks unusually red, swollen, oozing, or your baby seems very uncomfortable, please consult your pediatrician or pediatric dermatologist without delay. Early attention helps prevent complications and keeps your newborn safe and comfortable. We appreciate your participation and look forward to having you in our upcoming sessions. Have a wonderful evening and take care of yourself and your little one. Dr. Kumar, thank you so much again for joining us. This was really helpful.
Yeah, one take-home message, Caroline, I just want to give the parents. So most parents, I always wonder, they will ask us about how to increase the weight of the child, how to increase the height of the child, how to increase the color of the child also they will ask. But no parent, they will ask how to improve the brain power of the child, which really decides one child over the another. If they have a child to be a company CEO or the peon of the company, that is decided by the brain, right? So we would love to do a session separately how to improve the brain development. This is the first question the parent should ask the pediatrician. So instead of increasing the height, weight, and the color of the child. So if anybody is interested, the parents definitely we can take up that how to improve the brain of the child right from the day one. There is a huge science building up there, but that is what every parent must ask the pediatrician.
Thank you, Dr. Umar. I agree. We totally need one of those sessions here, how to improve the mental development of a child. Thank you so much for joining us. Thank you, parents. Thank you, everyone.